You're in the Yoga Nook with Robbie. I'm Robbie S.T. Willick, and today we're going to go over a series of 4 poses with some modifications to help with some release of the TMJ, the jaw. The TMJ is temporo-mandibular joint. So temporal for the temporal bones that makes up the upper part of the joint, mandible, the lower part of the jaw, and the joint right about here. Problems with pain, grinding, popping, clicking, sometimes locking in an open or closed position, difficulty eating, difficulty talking, doing some work with yoga or a little bit of massage around the joint, self-massage, can be helpful for releasing the muscles that control the movement of the joint and get that joint moving a little bit more freely. Keep in mind you should really keep things comfortable during this practice. These are suggestions. And if there's something that's not working for you, you can just stop, maybe ease up on the pressure of some of the things I'm suggesting. But we're going to begin with a modification of the Cobra pose, Bhujangasana. And we're going to be in this position using some props to support us. We're going to be doing a little bit of myofascial release. So this is sort of a muscular type of treatment, releasing the muscle tissue and the connective tissue, the fascia, myo for muscle, fascia for fascia, myofascial release around the masseter muscle that goes from really the angle of the jaw here to right around this little flappy part of the ear, the tragus of the ear. So kind of around the cheekbone area down to the angle of the jaw. And then a group of muscles that sort of hugs in under this U-shaped mandible, the lower part of the jaw, the suprahyoid muscles that really influence tension of the jaw. It can also create some tension around the neck and the throat. So we're going to get ourselves set up with some blocks and a bolster. If you don't have blocks, a stack of books, textbooks, or a food container that's sturdy about these dimensions can be helpful. And you can really play with the height here. I'm going to keep it pretty simple, keeping my block on the low position. And my bolster, it's maybe about 4 inches thick. I'm going to come onto our belly. So I have my pelvis resting on the floor. You can also have like a little blanket or pillow resting underneath your pelvis. It's a little kind of a bony joint there that can be a little irritated with some pressure, but yeah, carpet or a nice cushy yoga mat or a little bit of support there. And my upper part of the belly and lower part of the rib cage is resting on the lower part of the bolster. And I have some support here with my block propping up my chest so I don't have to really activate the muscles in my lower back to maintain this position. We're going to start first with the masseter, this muscle sort of on the side of the jaw. So in this position, elbows are on the mat, the forearms are just resting up against the bolster, and coming on to this kind of angular part of the jaw around the U-shaped bone, the lower part of the mandible, just sinking in. You'll feel that bony contact, that hard contact, and then a little bit of softness as you encounter the muscles that attach to that part of the bone. And we're using just a very modest pressure. If you're a numbers person, really a pound, 2 pounds might even be too much, but a gentle, comfortable pressure. I'm using my neck to support my head. So I'm not using my fingers to really support the full weight of my head, but I am allowing a little bit of softness, a little bit of release through my neck. So I'm just allowing my head and my jaw to gently sink into that presence or that gentle pressure with my fingertips at the jaw. So we're not going to spend a whole lot of time here. I'm going to basically show you the positions, and then you can play with the time on your own. A good amount of time for this would be about 60 seconds minimum. You can stay here for quite some time, even 5 minutes. You can get a nice deep myofascial release, a nice muscular release, connective tissue release, staying in it for 2 to 5 minutes. Eventually over time, starting from this lower part of the jaw where you have that kind of sharper angle, and then just allowing the fingers to slowly glide up. Not necessarily sliding along the skin, having a bit of a stretch in the skin as you're just sinking into the muscles. Eventually, maybe letting your head come forward a little bit, your chin coming down closer to your bolster, until you're to the upper part of that muscle that attaches right around the cheekbone. You'll feel a little bony part, a bit of an extension of the cheekbone, closer to that little flap of the earlobe, or the tragus, that little flappy part of the ear. But it's just this slow kind of stripping motion. We call it muscle stripping in manual therapy. Right around here and pressing up all the way up to about this level. So again, gentle pressure, really taking your time, keeping it comfortable. And we can be in that same position, coming with some fingertip presence in this suprahyoid region. So muscles that go from this area, the U-shaped bone of the mandible, attaching to a little floating bone in the middle part of the neck called the hyoid bone. So pressing in this area. Same position. Come onto our bolster. So your head might be a little angled back here, a little bit of a tilt of the head backwards. You can modify that maybe by bringing the elbows a little bit further away from the bolster. That's going to lower the position of your head so you're not cranked really far back. Again, it should be comfortable. Once again, I am keeping some activation of the muscles in my neck to keep my head upright, but just allowing a little easing of those muscles so I can really feel an engagement of that muscular connection along that U-shaped bone, the mandible, into that suprahyoid muscle group. 4 little muscles making up that muscle group in this area. So to come on to that structure, those muscular structures, you'll feel that kind of rim of the bone, that hard, bony feeling, and then come a little bit more towards the midline of your body to really sink into that muscular area. That distinction is pretty obvious. You'll feel that bony contact, and all of a sudden it just becomes more soft and kind of a fleshy feel. And the same thing, 60 seconds, minimum, but you can take a little longer time here, 2 minutes, 5 minutes, if that's comfortable for you. Again, should be quite comfortable. We're going to use child's pose, Balasana, for the release of another muscle. This muscle is the temporalis muscle. It's a large muscle around the temple region, so around this whole area, again, sort of above the cheekbone, coming close to the eye, around this area of the head. It's a pretty broad muscle, it's pretty thin, and close to the ear, so around this whole area. But we're going to start kind of sinking in to this area, and same idea, kind of letting a little support go in the head. So you can do this with fingertips. You may also want to do this with this part of the palm, around the fleshy part of the thumb and the fleshy part of this kind of pinky finger area of the hand, just having some presence on the side of the head, like so, in the child's pose. So let's try it. Let's find our position. We're going to set up our bolsters a little bit differently. 2 blocks, maybe choosing the medium height. You can just choose whatever feels best for you. We're going to bring the bolster in and the blocks in, so I really have it kind of snuggled up between my knees, the lower part of the thighs. And just coming to rest, so you have some support. You can get another bolster if you want. In fact, I'm going to do that because I have long legs and I want to have a good, comfortable support here. So a couple of bolsters if you want. Here, I'm using my fingertips, just letting my belly and my chest be supported on the bolster. If you feel really bendy or straining through the knees, you can put another bolster between your heels and the area around the buttocks. You can even come up onto your bolster. And again, use that fleshy part of the lower part of the hand. Just a gentle pressure. You're not trying to squeeze your head. Here you can really let go a little bit more. So in the other pose, I was really keeping some engagement, some activation of the muscles of my neck to make sure I wasn't having too much pressure on those muscles. In this position, you're able to let your neck go a little bit more. I still have a mild activation of my neck muscles, but I'm really letting more of the weight come to rest in the cradle of my hands here. The idea is the same. It's just this slow release, a bit of gentle pressure in that fleshy part around the temple region and temporalis muscle, with the idea over time of going from the lower part of the muscle up. It's a bit of a fan-shaped muscle, kind of tapers around the cheekbone and then fans out close to the eye, close to the ear, a big fan-like structure. So taking some time to sink in again, and then slowly over time, having that pressure where you're kind of sweeping up or guiding that pressure of the hand or the fingertips up to the higher part of the head. Again, 2 to 5 minutes is a good one to aim for. Okay, let's switch it up to a variation of the fish pose where we're going to be working with a block. So we are going to be working with, we worked with the suprahyoids in our child's pose. We're going to be working with the infrahyoids, so attaching to the lower part of that kind of horseshoe-shaped bone in the middle part of the neck, the hyoid, and then extending into the lower region of the neck. And also with the platysma muscle. It's a big, broad-shaped, flat muscle, a very thin muscle, but it's a large one, connecting to this whole underside of the mandible, the lower jawbone, sweeping through the front of the neck, the inside aspect of the neck, and really attaching to some of the muscular structures and the connective tissue in the upper part of the chest. This is a muscle that you might feel a bit of a stretch if you're doing upward facing dog, but this is a really quite a nice release for the muscle. So this is a supported Matsyasana fish pose. It's important when you're in fish pose involves quite a bit of tilt of the head backwards. If you're feeling some visual disturbances like black spots or stars, if you are noticing you're feeling nauseated, if you're feeling dizzy, if you're feeling a cramped or a strained feeling through the neck, probably your head is too far back and you should bring it a little bit more into a neutral position. So comfort, common sense in this position. But we're going to come onto our back, so our pelvis is snuggled up to one end of the bolster. And we're simply going to lie back. So in this position, you can see probably already that my head has a little bit of an angle backwards. And I'm quite tolerant of quite a bit of a backward bend of the neck. But again, you want to check in with those key symptoms like dizziness, nausea, a feeling of pain, or anything unusual happening with the eyes. Probably your head is too far back, and you should just kind of bring your head so it has a little bit more support at the base of the skull, resting on the upper end of the bolster. Yeah. So you're going to want to have a block handy. You don't have to have a block, it's a nice one. You can also use your hands in this area, and I'll show you both options. But with this little tilt of the head back, we're creating a bit of a length through the front of the neck and into this upper back region. So you can even have just the presence of your hands on the upper part of your chest, sort of that muscular area right underneath the collarbone. You don't want to be having a lot of pressure directly on the collarbone. There are some nerves and important blood vessels that pass underneath the collarbone, between the collarbone and the ribs. And if you're having too much pressure, that can irritate those nerves, reduce circulation to your head, and not ideal. But a nice gentle pressure with the palms. You can keep both hands, one on either side, just to the side moving a little bit aside from the midline. So you're not pressing on your breastbone and you're not pressing on your collarbones, but just some gentle pressure with the palms of your hands. You can do a little tilt of your head or a turn of your head to the side. As you turn your head to the right, this may engage a little bit more of a stretch sensation on the left side of the neck and the upper back. As you turn your head to the left, you may engage more of a stretch sensation through the right side of the neck and the upper back. You can also use your block. So this is a cork block and it's a little dense. If you have a foam block, that's a little bit more forgiving. You can play with what surface you want. You're going to place that against your chest, again, avoiding pressure on the collarbone, avoiding pressure directly on the breastbone, being more on the muscular component of the chest. You may want to play with just this very narrow area of the block and just pressing downward. So a little bit of pressure downward of that block toward the mat, but also guiding that block, or if you're using your hands, moving your block or your hands a little bit down towards your feet or your pelvis. You're engaging a little bit of pressure, maybe feeling an intensification of that stretch. Here the block is on my right side. If I want to increase that stretch sensation, I can turn my head to the left. And you can also bring your teeth together, not clenching the teeth or the jaw, but just a light presence of the teeth coming together. You'll feel probably that's creating a little bit more of a stretch sensation through the neck, through that upper chest area. And if it's comfortable for you and it doesn't engage any of those symptoms like dizziness, nausea, unusual visual, disturbances like the black spots or white lights, you can bring your chin a little further away from your collarbone and your chest bone, a little bit more tilt of the head backwards. Again, holding that for, on each side, I'd say maybe a little bit more modest time, 60 seconds, 2 minutes. If you're holding for a longer period of time and your head is in a bent back position and you're turned to the side in particular, you can limit flow of blood through one of the major arteries in the neck, the vertebral arteries, and start to provoke symptoms like dizziness or nausea. So if you're feeling that, bring your head more back to neutral, reduce the extent to which the chin is moving away from the collarbone. Again, just a little bit more of a neutral position for the head. The last pose we're going to work with is a modification of the reclined butterfly or Supta Konasana, seated star or reclined star. So in this position, what we're trying to do is create a release of the sub-occipital muscles. These are muscles that connect the very upper part of the neck to the very base of the skull. And this group of muscles also has connection to the dura, the connective tissue that wraps around the spinal cord and the brain that can go into a little bit of tightness. And the dura is very pain sensitive. A lot of little nerve endings called nociceptors that when activated by tension or pressure or inflammation, the stimulation of those nerves is heightened and you can really start to feel it as pain. So a source or contributing factor to migraines and headaches, but also the presence of those muscles in relation to the occiput is important. The occiput is that big bone at the base of the skull, and it has some pretty profound connections to the temporal bone, the upper jawbone. So doing some release of these muscles helps to create just a little general freedom of muscular tension, dural tension, and even a little improvement in the movement of the joints in the head. Although in adults they're fused, there's just this tiny available movement at the joint level, at the sutures. And you can get a little bit of a release, certainly of the soft tissues, but even of the bones. So we're going to be resting on our back. Let's do 2 blocks. If you have maybe one on the medium height, a little bit of space between the block on the medium height, we'll put our other block on the low height and rest our bolster on the blocks. This time we're going to be having our head fully supported in a neutral position to begin with on that bolster. So we don't want to have the head angled backwards as we did in that variation of the fish pose. The feet can be in any position. You can have your knees bent at about 90 degrees. You can have your legs totally straight, or you can come into an open leg position where the soles of the feet meet at the midline of the mat, and you just let the knees flare out. If you're feeling discomfort around the hips, the groin, the inner thigh area, you can have a block or a bolster, a rolled up towel, or some blankets folded between your mat and the outer aspect of your hips and the outer part of the thigh for a little bit of support. If you don't need that support, you can just stay where you are. But you can use either a bolster or somewhere here. Towel. You can use a rolled up towel or a folded towel to give a little bit more presence in that sub-occipital muscle group. Having that towel, we use a towel, placed right at the base of the skull. So the upper part of the neck and the base of the skull. Even just having that focal pressure there, that presence of the towel, that pressure creates a pressure on those muscles. And in the body, everywhere where there's a muscle that blends into a tendon, this is what muscles do, the muscular part becomes tendinous, the tendon attaches to the bone. But at that junction of the proper muscle where it blends into the tendon, there's this concentration of specific nerve endings called Golgi tendon organs. And when these nerve endings are stimulated with pressure or some modest tension, a really modest pressure or modest tension, that results in a stimulation of these nerve endings. And after about 90 seconds to 2 minutes, somewhere around that time frame, usually there's that stimulation of those nerve endings creates an actual release, a bit of softening, a bit of lengthening of the muscle, just because you're having that pressure on the muscle itself. So being in this position is a nice way to induce a little release of the sub-occipital muscles, those wee muscles that connect the two vertebrae at the very top of the neck to the base of the skull. And again, little extensions of those muscles into the dura, the connective tissue around the brain and the spinal cord. Another name for the dura is the meninges. If someone has meningitis, it's an infection or an inflammation of that tissue. But again, the dura with whiplash injuries or concussions, you can have some scar tissue formation or some tension that comes to bear on that dura that can lead to restriction of the joints of the neck, tension of the muscles, and this is just a nice gentle way to release it. You can over time do a little bit of movement, maybe a side to side movement of the knees, that slow metronome-like movement creates a bit of a scooting of the pelvis away from the bolster, and as the hips move away from this anchoring of the neck underneath your or the towel underneath your neck, this is a way to create a very subtle increase in the length of the spine, re-engaging tension on that small group of muscles, the sub-occipital muscles. So if you're really comfortable here, you can stay here for quite some time. If you feel like you've got too much pressure under your neck at the base of the skull, you can reduce the extent to which you have that, or reduce the thickness of that towel, or you may choose to even just take that towel away and maybe even bringing your chin slightly towards your collarbone, to create a little bit more length through the back of the neck, which will engage a little modest tension on that small muscle group, the sub-occipital muscles. So hang out here for as long as you like. This is all we're going to do today for our little TMJ, temporo-mandibular joint release, using some modifications with some standard yoga poses. Thank you for joining me today, and I hope you have a great day. Namaste.